Okay, this is it. Now, here's the key. The real key, of course, is for Laura sometime during this hour to tell me what it is that we're giving away. The most important thing is
Patrick, would you like to know?
you're here for the enjoyment. You're here for the bliss. You're here. What? Pardon me?
Away this, right here.
Right?
Here. Sorry.
Excuse me?
Sorry,
Pardon me?
Patrick, that's your giveaway.
Oh, Laura, as she humbly goes back into the room of grand mistakes. $50 gift certificate from Sheila Gino of Switzerland Beauty Salon. Not too bad. Even if you don't need it, probably somebody in the family's not too hot, okay? That's why we have CenturyLink. You make the call. Hey, listen, you know what? Almost everybody's favorite politician from the East Coast was Bill Bradley, former U.S. Senator, and it doesn't particularly matter whether you liked his politics or not. I know you liked his basketball. What NBA team did Bill Bradley play for? I said NBA. Don't tell me about Princeton. We all know that he went to college there. What NBA team did Bill Bradley play for? And you get the gift certificate, of course, to the Gino of Switzerland Beauty Salon. Dr. Siwek, I was going through near pain in your absence. It's been a long time.
It has been a while. It's been a while.
It's good to have you back. Dr. Siwek, having spent a great deal of time at Mayo's and now in private practice where?
Well, the Pain Center of Arizona is our practice, and boy, the last time you and I talked, I think we had about 4 locations around the valley. In a couple of months, we'll be opening number 11 and number 12.
Wow.
Right?
Well, in that period of time, I'll tell you, you not only have grown and developed, but so has the reality of pain in so many people's lives.
It has. It has to the tune of about 116 million people in the United States suffer with some issue of chronic pain.
What are the common types?
You know, the common types are what we see in our practice. Everything from neck pain, low back pain being a real predominance, to an issue of migraines, fibromyalgia, and then it kind of goes down from there, abdominal pain, neuropathic problems like shingles, and peripheral neuropathy being...
Boy, I tell you, when you hear about shingles anymore, you think automatically of just simply making a stroll through your pharmacy, through the drugstore, and see big signs. Shingle shots available here.
Right.
I never thought about getting a shot for any kind of condition in my pharmacy.
Well, you know, shingles is one of those ones that's real interesting. The simple way to put it is it's varicella zoster, a chickenpox virus, kind of come back when we're adults. Abdominal pain is one of those issues that's bad, but I'll tell you what, there's almost nothing as bad as shingles pain. It's a nerve pain problem, and as much as there's stuff on the counter, it can be a real difficult problem to deal with.
I saw commercials this morning, for example, numerous commercials about fibromyalgia relief, migraine headache relief, lower back pain relief. Look, I know you're a specialist in this field, and we've got to take care of the Siwek kids. But the reality is that an awful lot of people are told, if you pop a pill, you can take care of your pain.
Yeah.
What do you say?
Not always so true. You know, one of the real big problems that that we're dealing with, and one of the reasons I love coming on the show, even though it's been a while, is that we need to get back out there to the public and inform them of this epidemic problem that's happening. And you started to mention it. It's about pill popping. You know, prescription drug abuse is an epidemic in this country right now. And unfortunately, you know, you've got the easy way of doing some good ads and telling people, here's the magic pill, here's the magic potion, and it's not so necessarily true all the time. The flip side of it, of course, is that in the issue of this epidemic, we have multitudes of patients out there that are taking medications inappropriately or medications in combination with other medicines that are unsafe. It's a real big problem right
So
now.
if I'm taking pain pills, should I do so consistently with the ongoing advice of a medical practitioner?
No question about it. Here's the problem. The problem is that we're not so great at it as a physician community either. Here's the problem. You end up with an issue of pain and you go see potentially your primary care physician and then maybe a chiropractor, maybe a psychiatrist, maybe an orthopedic specialist, maybe a pain guy. And at some point, everybody's taking a shot at you. And unfortunately, everybody may be giving you a pill. And the patient at some level is doing what the physician says to do. Unfortunately, we're not doing a great job, physician to physician, informing each other what we're doing for you. So you end up with a medicine cabinet full of 5, 6, 7, 8 medicines, all potentially dangerous, all interacting with one another. You know, at the Pain Center of Arizona, we really are trying to bring a sense of orchestration to this otherwise noise that's chaotic.
And not only chaotic, but the kind of thing that creates such frustration, such stress and anxiety at one time or another in almost everybody we know. So what do you do that's different at Pain Center of Arizona
It's
with
a
your specialty?
great question. You know, one of the things that we focus on first of all is it's about an assessment and diagnosis. Let's first of all find out what truly is wrong with you. We've got good, excellent trained physicians. We've got a resource of diagnostics. So let's find out what the source of the problem is first of all. Once we assess that, let's find out what you've been doing, what's worked, what hasn't worked, what medicines are you on right now. Once we have that, then we can specifically find and focus a treatment unique to your problem. The best thing that we're going to do, however, is we're going to communicate with all of your providers, hopefully at least at a minimum, your primary care specialist or your rheumatologist or your cancer pain specialist that you've been seeing. And we're going to coordinate all of this under one roof. It provides more effective treatment, more efficient treatment, certainly less expensive treatment, and arguably a whole lot safer for you.
Now, I'm not going to put you on the spot. Although
Sure you are.
Every time that anybody in an interview ever says that as a preface, you know, there's going to be something coming up that
Perfect.
might make you uncomfortable, but
Right.
I'm here for these folks. And many of them probably now, particularly since the last election, want to know, is marijuana of any value at all if they finally get all the legalistics straightened out?
Yeah.
Is marijuana an analgesic that works?
Here's what marijuana does. And at some level, I will tell you, here's sometimes what narcotics do. While narcotics can be pain relievers, there are medicines that are supplement, and I'll put marijuana in that category, that don't decrease your pain. They just decrease how you perceive the pain.
Will they mask it?
At some level, it masks a little bit, but it makes you feel more comfortable about having the pain. Here's my big problem with the marijuana focus, to be honest with you. I could tell you, you pick a narcotic, you pick a medicine, and I could tell you how it is eliminated in your system. I could tell you the time that it takes to eliminate in your system. I could tell you how it is absorbed in your system. Marijuana changes everything. It not only affects the medicines that you're taking, but there's no consistency. How often do you use it? And, you know, how much do you smoke? And it makes everything so unpredictable. Unpredictable in the world of pain equals unsafe.
Okay, so now what about the pain claims that we continue to hear on every possible front? We're barraged with them. What do we have to look out for?
You know, you have to look out for words like cure, and you have to look out for words like 100% pain relief. Another thing that we're really trying to do at the Pain Center of Arizona is to reset patients' expectations. Patients that come to us are typically patients that have had chronic pain years and years, multiple surgeries, multiple trials. It's unfair. It's not right. It's flat out wrong for me to sit across the exam table from them and say I have a cure or I'm going to make you 100% better. As much as I would love to, it's not fair. What I need to tell them and what we are telling them is that there is a way there, whether it's a medication, physical therapy, an injection, a meeting with a behavioral pain psychologist, all of the above. We can tell them there's a way to make the pain that you have more stable, more controlled. The goal being, I want to get you a better level of functioning and a better quality of life.
One of the pains compounding the pain that you have already is to find out how much it costs you to get better and to be pain-free. What about insurance?
Believe it. So the Pain Center of Arizona accepts just about every insurance that are out there. You know, pain is no respecter of education and no respecter of insurance and no respecter of socioeconomic class. So we do our best to make sure that our treatments and our methods and certainly all of our clinics across the valley are available to everyone.
Now, of course, Dr. Siwek, I remember back when Dr. Siwek came down humbly with just a couple of centers. Now, how many are there?
Well, we'll have 12 by this fall.
And that means we have far too many to specifically list. So that means then that the easiest thing to do is to get in touch with you. How?
You know, our website, www.thepaincenter.com, is one of the easiest ways that you can get a hold of us. Everything is on there, all of our providers, all of our locations, and there's even a fun thing that we're doing called the Pain Channel, and next time I'm here, you and I will talk a lot about that.
Yeah, please do. I noticed that on the website. You have your own pain channel, and I want to find out from you the next time that you come down also about specific things like migraines. How many different kinds are there? I guess you never run out of subject material.
We don't. We see a lot of patients and see a lot of patients for a lot of different problems.
Well, I don't know whether you can solve the problem of pain in Washington, D.C., but perhaps our next guest can. Representative David Schweikert, representing the 5th District, is coming up next on the McMahon Group.